Hello, welcome. This is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. This show is for you, by you, and about you. Anything you want to know about good health, I want to talk about. So if you've got a particular topic or a particular subject that you want to talk about, give me a call, 407-1111. It is Wednesday, August 17th, 2022. And we are here from beautiful Wesleyan University campus. And we're going to talk about deficiencies tonight. There's vitamin deficiencies, there's deficiencies in iron in your blood, and so we're going to talk about some of those, talk about what we can do about it, how it makes you feel, why you should see your doctor, those kind of things. So we'll just get right into it, and I'm glad everybody's here tonight. I'm glad to be here. I'm glad to be seen. It's always good, better than that, than being sick or not being able to get something done, isn't it? All right. So first I'm going to talk about vitamin D deficiency. Lots and lots of us are deficient in vitamin D. And you get vitamin D from the sun, but you have to stay out in the sun 14 hours a day to get all the D that you need from the sun. And there are very few foods that have vitamin D in them. Milk, if you see anything that says fortified, it probably has D in it. Milk has vitamin D in it, which is great if you like milk, if you can tolerate milk, but some of us are lactose intolerant, so milk is not a good choice. Some of the fatty fishes have vitamin D, sardines, mackerel. Now I would eat that because I love fish, but not everybody's going to eat a sardine or a mackerel fish. So some breads have it, but if you're on a low-carb diet, or if you're gluten intolerant, or if you have celiac disease, bread and grains is not the answer for you either. So then we come down to supplementation, and that's how most of us have to get our vitamin D, is by supplementing it. I'm very big on supplements. I'm very big on natural. You all know that. And I'm very picky about where I get my supplements because I don't trust supplements from a lot of the major pharmacies and stores. I think a lot of it comes from China. Matter of fact, I know some of it does, especially in Walmart. And I certainly don't trust anything that comes from China. So, where do we get the vitamin D? What do we buy for a supplement? Why should we supplement? How often do I take it? How much do I take? There's a lot of questions that have to be answered with vitamin D deficiency. So, it can cause issues with your bones and muscles, and it also it can make you really fatigued and tired. You wake up tired, you go to bed tired, you can sleep 8 hours a night and you're still tired. Vitamin D deficiencies doesn't mean that you don't have enough D in your body necessarily. It primarily causes issues with your bones and muscles. Vitamin D is an essential vitamin that your body uses for normal bone development. And vitamin D also plays a role in nervous system, musculoskeletal system, and immune system. And then this article talks about a lot of people. I used to think that the darker people's skin was, the more melanin they had in their skin, the more apt they were to be deficient. And that might be true to a certain extent. But I'm very fair, and I'm vitamin D deficient. And I spend a lot of time in the summer outside, spring, summer, and fall. I like to do yard work. I get tan, and I'm still vitamin D deficient. So It's really become a worldwide problem. It used to be, you know, when we were farmers, most of us were farmers, and when people spent, you know, 14 hours a day out in the tobacco fields and here in the South, that you weren't quite so deficient. But that we don't do that. Excuse me, we don't do that anymore. So vitamin D is important. It plays a crucial role in the maintaining and balance of of calcium in your blood and bones. And you need good, you know, a good strong bones and the vitamin D in your blood so that you can be healthy. And D uses calcium and phosphorus to build bones and support healthy tissues. With chronic and or severe vitamin deficiency, a decline in calcium and phosphorus absorption in your intestines, leads to low calcium levels in your blood, which then can lead to hyperparathyroidism, which is an overactive parathyroid gland that is attempting to keep blood calcium levels normal. If your calcium levels aren't where they should be, you can get something called tetany, and that's a muscle problem. And I actually have had a young girl that had to be put in the hospital for the problem of tetany, which causes twitching in your muscles, uncontrolled twitching. So both hypocalcemia, low calcium, and hyperparathyroidism, if severe, can cause symptoms including muscle weakness, cramps, fatigue, and depression. To try balance the calcium levels in your blood, your body takes calcium from your bones, which leads to accelerated bone demineralization when a bone breaks down faster than it can reform. Of course, this also happens in osteoporosis. Osteopenia is a weakening of the bones. Osteoporosis is there's just big gaps in your bones where the bone tissue is gone. And then that can also turn into something called osteomalacia, which is soft bones in adults, and rickets in children. You don't hear much about rickets anymore because we have all of this supplementation now. But it could still happen, and it probably does happen in third world countries. I don't have that documentation in front of me, but that would not surprise me at all if that was the case. So osteomalacia and osteoporosis put you at a higher risk for bone breakage, bone fractures. And then rickets is the same as osteomalacia, but it's only in children. Since bones are still growing, demineralization causes bowed or bent bones. Anyone can have a deficiency. Infants, children, adults. Vitamin D may be more common in people with higher skin, melanin, who wear clothing with extensive skin coverage, particularly in the Middle Eastern countries. So, how common is it? Vitamin D is a global issue. About 1 billion, that's B billion people worldwide have vitamin D deficiency. And 50% of the population has vitamin D insufficiency. Deficiency means you're deficient, you really need it. Insufficiency means you got some, it's low, but your body is producing. About 35% of the adults in the United States has vitamin D deficiency. I am one of them. I have plenty of patients who have vitamin D deficiency. And then symptoms and causes, I've said that already. Muscle cramps, mood changes, fatigue. Severe lack of D in children causes rickets, and that is incorrect growth patterns to their bones. They have bent bones, muscle weakness, bone pain, deformities in joints. It's very rare. Children with mild deficiency might have weak, sore, or painful muscles. And, we've always said, your legs hurt when you're a kid, and we've always said, oh, it's growing pains. And maybe it is, but maybe it's a little lack of vitamin D, too. So I would really be sure that all of your kids take just a good, healthy vitamin that's recommended for children, because there will be D in it. Now, as you're an adult, and especially if you're deficient in D, there is not enough of D in a multivitamin, but there probably is for children. So the two main causes of vitamin D deficiency are not getting enough vitamin D in your diet and or through sunlight. Well, that's pretty hard to do both of those. And sometimes your body isn't properly absorbing or using vitamin D. And there's certain causes of vitamin D deficiency, some medical conditions, some medications, and if you've had a surgical weight loss or a weight loss surgery, that can cause it because you don't absorb the way normal people do. There's some environmental factors that put you at a bigger risk, older age, things like that. So medical conditions that cause vitamin D deficiency are cystic fibrosis, Crohn's disease, and celiac disease. These conditions prevent your intestines from adequately absorbing enough vitamin D through supplements, especially if the condition is untreated. Obesity is a problem. A body mass index greater than 30 is associated with lower vitamin D levels, and most all of us have a BMI of more than 30. I mean, I've seen some people with 50, 60, and 70 BMIs. That's really heavy. But fat cells keep vitamin D isolated so it's not released. Obesity often requires taking larger doses of vitamin D supplements to reach and maintain normal levels. Then kidney disease and liver disease can also cause vitamin D problems, and these conditions reduce the amount of certain enzymes, hepatic enzyme 25 hydroxylase from your liver, and 1-alpha hydroxylase from your kidneys. Your body needs these to change vitamin D to a form it can use. A lack of either of these enzymes leads to an inadequate level of vitamin D in your body. So some of the medicines that can cause vitamin D deficiency are, if I can make my fingers work and get to the next page here. There we go. Laxatives, steroids such as prednisone, cholesterol-lowering drugs, cholestyramine and cholestyramine, seizure-controlled drugs such as phenobarbital and phenton, rifampin, which is a tuberculosis drug. I took that drug once. I was exposed to tuberculosis when I worked in the emergency room. That is one tough antibiotic. I couldn't tolerate it. I was supposed to take it for 10 days. I think I took it for 3. I couldn't do it. And then Orlistat is a weight loss drug. I've never heard of that, so I'm not sure if that's even still on the market. I'll have to look that up during the break. And so you always tell your health care provider not only the medicines you take, but also the supplements you take and the herbs you take. So we diagnose vitamin D. People come to me and they say, I'm really tired, Linda. I'm just tired all the time. Well, there's a lot of factors that can make us tired. Stress can make us tired. And we're all stressed out. We live in such a chaotic world. But there's physical problems that can cause fatigue, being tired, low iron, and we're going to talk about that a little bit later. Thyroid problems can make you feel tired. Low vitamin D can make you feel tired. Sleep apnea can make you feel tired. Being depressed can make you feel tired. So there's a lot of things, but I normally test the labs. I'll get the vitamin D level, the vitamin. I usually get a vitamin B as in boy as well. then your iron level and your thyroid is checked. And if you have symptoms of sleep apnea, because if you're not sleep, even though you might think you sleep, when you have sleep apnea and your body stops breathing multiple times at night, that can make you really fatigued too. So there's a special test called the Epworth sleepiness test that I do, and if you test positive on that, then I'll go ahead and order a sleep study for you as well. So that's pretty much how it's diagnosed. I find it very interesting that even though vitamin D is so important to our physical health and well-being, many insurance companies are no longer paying for the test or paying for the medicine. So I don't know what their reasoning is, other than, I don't know, I guess because it's costing too much money. There's so many of us. I don't know. But that they started paying for that, I'd say 4 or 5 years ago. And it's just progressively, it started out with 1 or 2 small, I think Blue Cross was the first one I noticed, but there's there's multiple Blue Cross and Blue Shield insurance policies. So just because you say you have Blue Cross doesn't mean you have that particular Blue Cross. But I think that was one of the first ones that I noted. And then it's just becoming more and more. So unfortunately, if you're vitamin D deficient, even if you're deficient, they still won't pay for it. So if you're deficient and you need to have those blood tests, you might want to check with your insurance company to see what their reimbursement is. The goals of treatment and prevention for vitamin D deficiency are the same: to reach and then maintain an adequate vitamin D level in your body. And like I said, there are some foods that have it. Most people take the over-the-counter supplements. Now, a pharmacy I know here in town, Ward's, they have a 50,000 international unit vitamin D, and I usually take that once a week, and that's enough to maintain my vitamin D. I think the highest I've seen in other stores and pharmacies is 10,000. So I usually tell my folks to take 5,000 a day, which is 35,000 international units a week. Some people would rather just get the 50,000 and take 1 a week, and that's fine. There are 2 forms of vitamin D. There's D2, which is ergocalciferol, and that comes from plants. And then D3, cholecalciferol, comes from animals. You need a prescription to get D2. D3 is available over the counter. Your body more easily absorbs D3 than D2. However, some people have to take both. And I've got patients that if they're on D2, it doesn't come up. And if they're on D3, it doesn't come up. So sometimes I make them take both of them to help them get it come up. So that's pretty much vitamin D deficiency. We're going to move on to, if I can find the end of this and the beginning of the next one here, vitamin E, as in egg. That's a nutrient that's important to vision, reproduction, and to health of your blood, brain, and skin. Vitamin E is not a real common deficiency. However, if you have celiac disease, you're probably deficient in vitamin E. And it's time for our first break. So when we come back, I'll talk to you more about vitamin E. So don't go away. We'll be right back.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, welcome back. We're going to talk about vitamin E now, E as an egg. And I said earlier before the break that it's important for vision, reproduction, health of your blood, brain, and skin. It has antioxidant properties, and they're substances that protect your cells against the effects of free radicals, which are molecules produced when your body breaks down food or is exposed to tobacco smoke and radiation. Free radicals can play a role in heart disease, cancer, and other diseases. If you take vitamin E for its antioxidant properties, keep in mind that the supplement might not offer the same benefits as naturally occurring antioxidants in food. Foods rich in vitamin E include canola oil, olive oil, margarine. Don't ever eat margarine, never. Almonds and peanuts. Margarine is one molecule away from plastic. We do not need to put man-made junk like that in our bodies. Don't eat margarine. You can also get vitamin E from meat, dairy, leafy greens, fortified cereals. Vitamin E is also available as an oral supplement in capsules or drops. And again, probably in a good multivitamin, there is enough E in that for you for a day. So you don't have to go and get a bottle of this and a bottle of that. If you're not deficient, that would be probably enough to keep you going where you're supposed to be. Vitamin E deficiency can also cause nerve pain called neuropathy. And vitamin E has been researched for Alzheimer's disease and shown that a high dose of vitamin E may delay the progression of Alzheimer's disease in people who have been diagnosed with mild to moderate Alzheimer's disease. Other studies haven't shown this benefit. Vitamin E supplements appear to have no effect on people with mild cognitive impairment progress to the Alzheimer's disease. So, I don't know. I just think it's probably good to take a little bit of everything. And then studies show that vitamin E might improve the symptoms of a non-alcoholic fatty liver disease. Fatty liver disease is also known as cirrhosis, and there's a lot of us that have it from too much fat in our blood. And it's getting to be pretty commonplace in my patients, unfortunately. So there is some evidence that suggests taking vitamin E can help. So again, it's worth it to take the little supplement in the multivitamin, I think. Preeclampsia, of course, this is a condition in pregnancy when your blood pressure goes up, and that has not, well, I guess it has not been shown to really help. Prostate cancer, and that hasn't been shown to help prostate cancer either. So, appropriate doses of vitamin E are generally safe and they don't bother you. But if you have too much, or if you're intolerant to it, nausea, diarrhea, intestinal cramps, fatigue, weakness, headache, blurred vision, rash, gonadal dysfunction, and increased concentration of creatinine in the urine. High doses of E can also increase other side effects, such as increase the risk of death in people with severe history of heart disease. And talk to your doctor before taking vitamin D if you have a vitamin K deficiency. And I didn't print that one off. I forgot about that. An eye condition in which the retina is damaged, bleeding disorders, diabetes, history of prior heart attack or stroke, head and neck cancer, and liver disease. The supplement might increase your bleeding. So if you're going to have surgery, stop a couple weeks before your planned procedure. And then you probably always need to just talk to your doctor about vitamin E. But, you have to have a certain amount. And I've got a couple patients that have celiac disease, and both of them are deficient in E. There's anti-tumor antibiotics that high doses of vitamin E might affect their use. Anticoagulants and antiplatelet drugs, vitamin E can increase bleeding, so you have to be careful with that. And then if you take omeprazole, Prilosec, and with some of these medicines that help with heartburn, that can be affected if you use vitamin E. And statins and niacin, a lot of us are on a statin to reduce your cholesterol. And niacin is actually used to reduce cholesterol as well. But vitamin E could reduce the niacin's effect. So I just thought that was interesting because I have somebody that, a couple patients that have that, and I had really never heard about it or thought about it prior to this young man who has celiac disease came in and said, I need my vitamin E checked because I'm deficient in it. So, all right, let's move on to vitamin B as in boy. Most of us, if we're going to be deficient, we're deficient in B12. And it's very treatable, and it's very common for people to have a B12 deficiency, and it's very easy to supplement the B. So vitamin B can cause, it happens when your body is either not absorbing enough vitamin B from the food that you eat, and you might just for some reason, you might have some kind of a genetic problem that doesn't allow the vitamin B to be absorbed. And vitamin B deficiency can cause physical, neurological, and psychological problems if it's not treated. It's a very important nutrient that keeps your body, your nerve cells, and your blood cells healthy. I had I call her young, a young woman. She was 40, 42 in there someplace. I consider that really young, being as how I saw that a long time ago. But she had complained about neuropathy in her feet and legs, and the pain in her feet and legs. And she had been on a medicine called gabapentin, which is made for nerve pain, for over 10 years. And she was tired of taking that medicine, and she wanted to know what the problem was. And so I did a bunch of tests, and I did vitamin B, and she was deficient in that. Once we started giving her vitamin B shots, you can get one. Usually it's every month, but sometimes your levels are so low that you have to take it about every 2 or 3 weeks. But normally it's every 4 weeks. Well, once she started getting on that supplement, she felt so much better, and she got rid of the gabapentin. So vitamin B is always in the back of my mind since I had that patient. Your body does not make vitamin B12 on its own, so you have to consume food and drinks that have vitamin B in them. Vitamin B12 is found in animal products, meat, dairy, eggs, some fortified foods, certain cereals, bread, and nutritional yeast. Adults need about 2.4 micrograms of vitamin B12 a day, and people who are pregnant and breastfeeding need more. The amount of vitamin B babies and children needs varies on their age. There are 2 things that need to happen in order for your body to absorb vitamin B12 from the food you eat. First, hydrochloric acid in your stomach removes vitamin B from the food it was in. Then the vitamin B combines with something called intrinsic factor, a protein made in your stomach. Vitamin B12 is then able to be absorbed by your digestive system. Some people have a rare condition called pernicious anemia, which means that their stomach does not make the intrinsic factor. Because of this, the body cannot properly absorb B12, which then in turn causes a B12 deficiency. And deficiency, of course, is when you don't have enough, and you need vitamin B to make good, healthy red blood cells. And so because there's a lack of vitamin B12, a lot of people have anemia. People can have a vitamin B12 deficiency without having anemia, however. And, you know, vitamin B deficiency can hit anybody. 1.5 to 15% of the U.S. population has vitamin B12 deficiency. And this just breaks up into the different age groups. I don't think we care what age. If you're deficient, you're deficient, and you need to get it replenished. So lack of vitamin B in your diet can cause deficiency. Gastritis, which is an inflammation of the stomach, is a very common cause of B12 deficiency. Pernicious anemia, which we just talked about, and that's when you don't have, your stomach doesn't make the intrinsic factor, and that what you need in your body to absorb the B12 is this intrinsic factor. Then there's digestive problems like with Crohn's disease and celiac that prevent you from absorbing the B12. Alcoholics don't absorb the B12. Gastrointestinal surgery, weight loss surgery, people have difficulty. And then there's a rare genetic disorder that impairs the transport of vitamin B12 within the body. I've never seen that, but I maybe never will. I don't know. See something new every day. So vitamin B12 deficiency can cause physical, neurological, and psychological problems. And those with B12 deficiency can develop slowly and get worse over time. Some people have no symptoms despite having low B12 in their bodies. And it can cause, some anemia, and we don't want that. That's lack of blood cells. So some of the symptoms are feeling very tired or weak, experiencing nausea, vomiting, or diarrhea, not feeling as hungry as usual. I don't ever have that problem. Weight loss, having a sore in your mouth or tongue, and having yellowish skin. A lot of people that have a lot of cold sores in their mouth and on their lips are low in B12. And then the deficiency can also include numbness and tingling in your hands or your feet, vision problems, having a hard time remembering things or getting confused easily, having a difficult time walking or speaking like you normally do, and if a neurological problem develops from low B12, it might not be reversible. So some of the symptoms may also be feeling depressed, feeling irritable, or experiencing a change in the way you feel and behave. So you diagnose this by taking a test, a blood test, and then we treat it with giving you vitamin B12 injections. There is some nasal gel and some nasal spray. I've not used those. I'm not sure how they work. So risk factors, if elderly, the older we get, the less our bodies use these vitamins that God gave us, and we have to supplement. A strict vegan or vegetarian diet can cause a deficiency, because especially you don't eat meat, and some vegans don't have any milk products or eggs as well. And certain medicines such as metformin, which is that's a real common drug for type 2 diabetes, and protein pump inhibitors and H2 blockers. Those are all the medicines that you take for heartburn. That can cause a problem with B12. And then oral birth control pills can take that too. And then this is interesting, having Sjogren's disease, which is an autoimmune disease, people are 12 times more likely to have a vitamin B12 deficiency from Sjogren's. So, you've got to avoid alcohol, eat the foods that has B12 in it, and then if you don't eat those foods, if you're a vegetarian, be sure you take a dietary supplement. So, the biggest thing that I have seen is peripheral neuropathy, and that's very painful. So we need to get that under control. That's for daggone sure. All right. We're gonna, we'll take our next break, because I'm just about ready to go into iron deficiency anemia. That's another pretty common malady that a lot of us have, but sometimes it's just good to hear about it and figure out exactly what we need to do about it. So when we come back, we will talk about iron deficiency anemia. Don't go away. We'll be right back after these commercial breaks.
Come celebrate our 20th anniversary with us and see how we can help with your hearing challenges and hearing care. To celebrate this monumental occasion, when you buy a pair of Livio 1600 series hearing aids or higher, you get one hearing aid for free, because it helps to have a spare of equal or lesser value. We know how inconvenient it is to have your hearing aids serviced, maintained, and repaired without a spare. As a community provider, we are focused on individualized care as personalized as your fingerprint. We build relationships with our patients and believe that is the only way to provide the quality of service that has kept us in business for more than 20 years. We have grown and stood the test of time while embracing technological advances and innovations in our industry. We couldn't do it without all of you.
You don't know what anybody can do for you until you have a problem. And when you have a problem, is how the person works through that problem that makes them effective, makes them beneficial in your life. I get involved in a lot of activities at our church. And with the music and things that are going on, I'm going to my noisy setting quite a few times, and then depending upon who's speaking, I may be going to what they call a theater setting, which is a higher level, and so you have to negotiate through. You only have, in my case, I only have like 3 different levels now. She does have some technology. We have some different volume controls. I don't use that, and I have to work with her. And rather than having to come back to the office, it's easier for me to call her wherever she's at, and we'll set us up a time, and then she will readjust my hearing aids over the telephone, which works real good. And I've used that quite frequently. But usually once you get set up, you don't typically have to change much. And a lot of times people don't want to go through the pain of the setup process, but if you don't spend the time in the setup process, you're not going to have the long-term results.
We are thankful to our faithful customers and look forward to many more years of service to our community.
I would say patients, they say it for us. You know, they refer people to us all the time, and they're not going to refer if they're not happy with you. If they don't think you're going to take care of their friend or their family member, they're going to you're going to shut right up. They're not going to say anything. And I've built my business on 75% referrals.
We offer convenient financing, layaway, and many pay options to ensure that our customers have comfortable experience getting quality equipment, reliable service you can depend on, and the product that fits both your physical and financial needs. Please visit our website, downeasthearingcare.com. Don't miss out. Schedule your appointment today. This month, we would like to invite you to our VIP 20th Anniversary Open House Hearing Healthcare event. During this event, we are offering 1 free Livio RIC hearing aid with the purchase of 2 Livio MRIC devices per person. Receive an expert, no-obligation hearing consultation and free product demonstration. This limited-time offer is available at our local hearing clinics. Get answers to all hearing-related questions. You can reach our convenient locations in Knightdale at 919-500-7455 or Rocky Mount at 252-378-2018.
All right, welcome back. This is Here's to Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and we talk about how to keep you healthy. So we're talking about iron deficiency anemia. And just as the name implies, iron deficiency anemia is due to insufficient iron. We need, our iron carries our red blood cells. And the red blood cells carry oxygen into the body tissues. So if your red blood cells aren't healthy, you're going to be short of breath. You're going to not feel well. You're going to, huff and puff when you walk from the car to the back door of your house. And that's because you're not getting enough oxygen. It causes a shortness of breath. So, we need the red blood cells to do all that for us. A lot of times you can correct this problem with iron supplementation. Sometimes you need something extra, but usually something, you can buy iron. It's all over the counter now. If you're deficient, you need at least 325 milligrams of ferrous sulfate to take. And you always take that with orange juice or some kind of citric acid, because it helps it to get absorbed better. And you can start to become iron deficient, and you don't really know that something's happening. But as your body, as the B12 becomes less and less, you can have extreme fatigue, you can have pale skin, chest pain, fast heart rate, shortness of breath, headache, dizziness, lightheadedness, cold hands and feet, brittle nails, inflammation or soreness of your tongue, unusual cravings for non-nutritive substance such as ice, dirt, or starch. A lot of people eat clay around here. Poor appetite in infants and children with iron deficiency anemia. So, iron deficiency anemia isn't something you should dictate or diagnose yourself. If you think you have it, then go and talk to your healthcare worker, and they can do a test. You know, it's a blood test to see if you're deficient. Overloading the body with iron can be dangerous because excess iron accumulation can damage your liver and cause other complications. So, causes of iron deficiency are blood loss. Blood contains iron with blood cells, so if you lose blood, you lose some iron. Women with heavy periods, or even some women that, you know, we all menstruate, we lose blood once a month. That's how our bodies were made. And I see most iron deficiency anemia in young women, and once they stop cycling, when, you know, that time of their life has passed, then a lot of times the anemia goes away and they'll go back to normal. But you can have bleeding from a peptic ulcer, a hiatal hernia, colon polyp, colorectal cancer. All these things can cause iron deficiency anemia. Gastrointestinal bleeding can result from regular use of some over-the-counter pain relievers, especially aspirin, and, you know, BCs, they're terrible for that. Non-steroidal anti-inflammatories, Aleve, ibuprofen, they can do that. You always have to take those medicines with some food so you don't cause that bleeding. And then a lack of iron in your diet. Iron-rich foods include meat, eggs, leafy green vegetables, and iron-fortified foods. Some people have the inability to absorb iron, and that's caused by a problem in your small intestine. And like celiac disease, once again, you know, celiac disease causes a lot of absorption problems in our bodies. And then if part of your small intestine has been bypassed or removed surgically, that can affect your iron absorption. And then women that are pregnant might also have that because of the increased blood volume you carry when you are pregnant with a child. So the risk factors are women, bleeding every month, infants and children, especially those that were born prematurely or have a low birth rate, or who don't get enough iron from breast milk or formula. Vegetarians, because they're not eating enough foods that are iron rich. And then frequent blood donors. If you know, my granddaughter has a very rare, I think it's B negative blood type, and so the blood bank is always calling her, give blood, and she bless her heart, she can't do it. She about passes out every time they stick a needle in her. But, you know, if you are able to give blood and they call you frequently, you could give too much, and then that would cause you to have a problem. So some of the complications from iron deficiency anemia: heart problems that can lead to an irregular or rapid heartbeat, and then your blood has to pump more blood, your heart has to pump more blood to compensate, to get those blood cells out there to get the oxygen. And so this can in turn lead to an enlarged heart or heart failure. Problems during pregnancy, you know, you just have to be sure you get enough iron when you're carrying a child. And so, you know, iron-rich foods, red meat, pork, poultry, seafood, beans, dark leafy vegetables such as spinach, dried fruit, raisins, apricots, iron-fortified cereals, bread and pasta, and peas. Now, I don't know if that's field peas or English peas, it just says peas, so I'm not sure which one of those. And then choose foods with vitamin C. I told you this, a citric acid, that to enhance the iron absorption. And so, you know, you can take your iron with citrus juice, orange juice. Vitamin C is also found in broccoli, grapefruit, kiwi, leafy greens, melons, oranges, peppers, strawberries, tangerines, and tomatoes. All that sounds pretty good. I'm kind of hungry. And so, you know, we just have to be sure that we get all the iron that we need. And there's plenty of places to get iron. It's easier to find iron than it is to find vitamin D in foods, that is. And so we talked a little bit about pernicious anemia. I'll never forget when I was in nursing school at Nash Community College years ago, and I was on a clinical rotation, and my clinical instructor said one of my patients had anemia, and she said, Linda, what are all the causes of anemia? What are the names of the anemia? Well, I was like a deer in the headlights, you know. I just looked at her and went, iron deficiency, that's low iron. And then she said, yes, but what about pernicious anemia? And I said, I don't know. She said, write me a paper and we'll see it. We'll talk about it once you write the paper. So that's what happens. You get a tough instructor, and she's going to make sure that you know exactly what that is and you won't forget it. So it's really, it's a autoimmune condition, and it's from the intrinsic system that, you know, doesn't work well. So most people do not have that. That's one of the less common ones. So this autoimmune condition prevents your body from absorbing the B12. And so that you're going to have supplements. So some of the problems with that, as we've already talked about, nausea and bloating and palpitations, heart rate. So, and pernicious anemia does target certain people groups, and people age 60 to 80 of Northern European descent. It's to affect that pernicious anemia affects about 150 out of 100,000. So I'm of Northern European descent. I'm from I'm 50% Swedish. My father was Swedish, and so I don't have pernicious anemia, which I'm very grateful for. But you know, it could have happened because I'm from that population group. All right. Then we have anemia of chronic disease. So chronic disease, of course, is a disease that you have all the time. If it lasts longer than 3 months and has inflammatory properties, and that can affect your body's ability to absorb the iron, and that is from lack of enough blood cells, as we've talked about. So this disease is, you see in just about every person on kidney dialysis. The chronic inflammation can affect your body's ability to make enough red blood cells, and those that are affected, I don't know exactly why, but I know that every person that's on kidney dialysis gets blood products or some kind of a transfusion. It's called EPO, and they get that during their dialysis treatment. So diseases that can cause anemia, cancer, chronic kidney disease, that's why we have to go on dialysis, heart failure, autoimmune diseases, rheumatoid arthritis, lupus, vasculitis, sarcoidosis, inflammatory bowel diseases such as Crohn's, ulcerative colitis, irritable bowel syndrome. So probably this is the second most common type of anemia. Iron deficiency is number 1. Pernicious anemia is the most rare. There's another one too, but I can't remember it, and it's really super rare. So it's time for me to say goodnight. Thanks for listening. Thanks for watching, and I will see you next week with more of Here's to Your Good Health. Good night.